Hello, everyone. Welcome back to Let's Talk Sarcoidosis. I'm your host, Dorothea Howard, and today in the studio, I have Professor of Neurology, University of Maryland, Dr. Walter Royal III. And I would like to welcome you for taking time out of your busy schedule to be here today, Dr. Royal.
Thank you very much. It's a pleasure to be here today.
Thank you. And I know that, sarcoidosis affects the nervous system, so it's really great that you're here to talk about, how you can help, and then what we need to know about sarcoidosis of the nervous system. So I want to start out asking you first, Dr. Royal, what is sarcoidosis?
Well, sarcoidosis, it's an autoimmune disorder, disease whereby the body's immune system attacks the tissues in the body. And it can attack many different types of tissues, the lungs, the skin, the liver. As neurologists, we are very interested in understanding how to better diagnose and treat people who have nervous system involvement with sarcoidosis, which is uncommon. About 5% of people have just involvement of the nervous system by their sarcoidosis. Up to between 5 and 10% get involvement of the nervous system. And just like the disease in general, there's a lot that we need to learn, both in making a diagnosis and also in treatment, especially in treating patients.
So my next question is, what is neurosarcoidosis?
Well, NeuroSarcoidosis is when sarcoidosis affects the nervous system. Let me say, of course, when it comes to diagnosing sarcoidosis, doing a biopsy, being able to see the pathology can nail the diagnosis. But when it comes to the nervous system includes the brain, the spinal cord, the optic nerves, and just the nerves elsewhere in the body, and the muscle. And sarcoidosis can affect all of those. So when we talk about neurosarcoidosis, we are really referring to any part of the nervous system that's involved by the disease.
Mm-hmm. So Dr. Royal, how often does sarcoidosis affect the nervous system?
Well, it affects about 5–10% of people with sarcoidosis. So, and sarcoidosis is not a very common disease. So when you look at those numbers, you're talking about an even smaller number of people who have nervous system involvement. And the reason why it can be difficult to diagnose is because we do not have, other than biopsy, we don't have a diagnostic test, a blood test that you can do that's sensitive for detecting the presence of the disease. And in addition, there are some other diseases that on certain tests can look just like sarcoidosis, such as multiple sclerosis, nervous system involvement by Lyme disease. And when it comes to those diseases, again, we don't have a blood test. Lyme disease can be detected by blood test, but the test isn't always sensitive enough to identify every case of Lyme disease. So it can be very tricky making the diagnosis of sarcoidosis.
And I know you mentioned it briefly, but just to go back to it, how can sarcoidosis affect the nervous system?
Okay. So really sarcoidosis can do almost anything. Many people are aware of the fact that sarcoidosis can cause sort of what we call a mass lesion in the brain. That is, it's a collection of inflammation, inflammatory cells that cause the formation of something called a granuloma, which is sort of a focus of inflammation. You can see that occurring in various parts of the brain itself, or even in the spinal cord, in the optic nerves. And that can be seen when a person has an MRI scan or a CAT scan. Of course, MRI scan is going to be more sensitive. In addition, sarcoidosis can affect the coverings to the brain, the meninges, and cause what's called a pachymeningitis or a meningitis. And meningitis just refers really to the inflammation that's taking place in the meninges. It's not really referring to an infection in the usual sense. Um, Again, you can get that sort of involvement. Uh, you can see these granulomas show up elsewhere, like in the muscle or in the nerves, just as you can have them appear in the skin. In addition, there's something called sarcoid, a painful nerve involvement, painful neuropathy that doesn't appear to be in, doesn't appear to result from granulomas themselves involving the nerves, but inflammatory cells release these factors into the bloodstream called cytokines, which sort of mediate a lot of the inflammation that's taking place, and those factors, those cytokines, can affect the nerves themselves to cause a painful sensory neuropathy and sarcoidosis. So we can see the direct effects from the granulomas, some of those other more indirect effects. Other indirect effects can come from a mass lesion pressing on something else. Sarcoidosis can affect the blood vessels. So some people may actually develop a stroke or even a brain hemorrhage from sarcoidosis. And it really speaks to the fact that essentially any tissue in the body, any location within those tissues, which are accessible by blood circulating, can be affected by sarcoidosis.
So, Dr. Royal, let's clarify, who actually gets this disease?
Well, really just about anybody can get it. It's very unusual in children, all races. It's just about anywhere in the world you can find the disease. You tend to see differences as to who's more likely to get the disease. So some studies have been done looking at that, and they do show that people of African descent, African Americans, have a higher risk for developing sarcoidosis. Many estimates are around about a 3-fold risk. There are some others that estimate that the risk is 7 times, or even 12 times, or even higher for African Americans. So when you talk about how often you see the disease, certainly in communities where you find predominantly African Americans, certainly you'll see mostly African Americans with the disease. But in clinics, you'll see people of all types, of all descents and origin come in potentially.
And I know, Dr. Royal, a lot of viewers, especially those who think they may have sarcoidosis,
Right.
because they watch the show and they listen to some of the symptoms. So can we at least let the viewers know, how is sarcoidosis diagnosed?
Okay. Well, let me just finish with an answer to your other question. So that actually women also have a higher risk of developing sarcoidosis. But the classic, the most definitive way for diagnosing sarcoidosis is by biopsy, to actually show the inflammation that's taking place. And again, the inflammation is in a form of what's called a granuloma, which is of a collection of inflammatory cells, different types called macrophages and T cells, and different types of those cells. Very often when we talk about inflammation, we're referring to a process where these cells come in the context of an infection or some injury or something like that, and when the process when that infection is over or the injury is healed, they clear out. But in this case, it's a chronic sort of inflammation. It's ongoing. It can be progressive. It can increase. Now, I should say that some forms of sarcoidosis can we don't expect to see this very often in the nervous system, but many people more familiar with the disease may be aware that for some patients the disease may be self-limited. That is, patients may have a mild form and it can resolve on its own, so to speak. But generally, especially when it comes to the nervous system, it's going to be chronic inflammation whereby you get these granulomas formed, And if one is able to identify a location where one is and do a biopsy, one can make the diagnosis by demonstrating those granulomas. Now, it's not always a good idea to biopsy the nervous system because it means going through the skull and, which under certain circumstances, it's these days when it comes to surgical procedures, that's something that's not considered necessarily major surgery. But if one has the classic findings in the brain that you would expect to see with the nervous system involvement, and there is a lesion accessible in the skin or even in the lung, one can biopsy that, show the abnormality, and on the basis of that information, diagnose that individual with NeuroSarcoidosis.
And with NeuroSarcoidosis, are there any risk factors with people that have that? Can you explain some of the risk factors that could come along with that?
Well, we really don't understand all the risk factors very well.
Okay.
There are some genetic risks. A few genes have been identified that you tend to see more commonly in people with sarcoidosis. A few genes have been identified that you don't see involved, which you would expect to be protective in some people with NeuroSarcoidosis. It's clear, though, that if you have a family member with the disease, that especially for African Americans, it tends to be an increased risk of a sibling or a child of someone with sarcoidosis developing. It's not high risk, but there is that risk there, and it's something to keep in mind. Again, sarcoidosis is an autoimmune disease, and what we're learning about autoimmune diseases is that the inheritance that you see is not as cut and dry as some other types of diseases where you can predict that based on the genetics, there's a 30% risk or 50% risk just by looking at how the chromosomes from mom and dad will segregate out. Sarcoidosis tends to be what we call a complex disease, where it looks like there are probably a number of genes that are, and some are having effects together. And it's not clear whether the actual genetics itself accounts for a large amount of the risk. We're learning that with many autoimmune diseases that there are probably environmental factors that are important. And over the years, we've heard about various exposures that, pine tar and that sort of thing. History of TB, it's not clear what role those may play, but certainly there's tend to be some environmental risks involved with most autoimmune diseases. It's probably the same as well with sarcoidosis.
Okay, and for the viewers, can you name some of the symptoms? So if somebody's out there and they're thinking, wow, maybe I have NeuroSarcoidosis, so can we talk about a few of the
Sure.
NeuroSarcoidosis symptoms?
Well, as is the case when it comes to other diseases and disorders of the nervous system, it really depends on what part of the nervous system involved. So in a certain part of the brain, you tend to see strength or sensation control. So if a person develops numbness on one side of the body, and some of these symptoms are similar to what you might see in somebody who has a stroke, which is the case with MS, and it really just speaks to the fact that the lesion, the sarcoid granuloma, or the area that's involved may control that sort of function. Some people who might have the eyes involved, they may develop decreased vision. If the optic nerve is involved, if, let's say, a person has inflammation in the eye itself, you may also see some decreased vision, but some evidence of some changes in the vision from the inflammation of floating in the fluid in the eye that can. So or eye pain can occur with some people. But basically, it depends on the part of the nervous system. So weakness, numbness, tingling. The sensory neuropathy tends to be a painful neuropathy, and the pain can be very hard to control with the usual medications. So for as many functions as the nervous system can control, that's about what you can see with sarcoidosis. In general, if one is concerned, it's obviously a good idea to contact one's physician
Right.
to try to get an answer, because again, there are so many other diseases that can cause problems that are very similar to sarcoidosis. One has to be sure that it's not related to one of those. And of course, if someone already has a diagnosis of sarcoidosis in the lungs or in the skin or somewhere else, and they notice some neurological problem or something not quite right,
Right.
it is important to check to be sure that the nervous system is not being involved.
Okay. And what are some of the clinical manifestations that involvement with neurosarcoidosis?
Well, one can develop decreased vision from the optic nerve being involved. Again, from the brain tissue being involved, we think about, again, the weakness or on one side of the body or the other. If the spinal cord is involved, one might see weakness that can occur on both sides of the body and both legs, with both sides of the spinal cord being involved at one time, since it's such a small structure. One can see loss of sensation in that same way, or pain can occur with sarcoidosis as well. There's the neuropathy pain, but then there's the pain that can come from that specific area of the brain being involved by the sarcoidosis. And from the so-called sarcoid meningitis, that is the inflammation occurring, affecting the surface of the brain, the meninges, which are the coverings of the brain. One can actually have some of the nerves, as they're leaving the brain, involved. We call those cranial nerves. And the cranial nerves are what control the movement of the face. Vision, the optic nerve, is another cranial nerve. So just as you can have some problems with vision, a person may develop, let's say, a Bell's palsy, which is something that, if that happens, it's a sign that that person should be checked. In addition to being checked for other things, sarcoidosis is something that you'd want to really check for.
Now, can this disease be prevented?
Well, we don't know of any preventative measures at this time. That'll come with really understanding what causes it. If the genetic issue was a large enough factor, theoretically one could try to avoid whatever it is that genetic susceptibility might bring along. But we really don't know how to keep sarcoidosis from happening, except to live lifestyles that support a healthy immune system. But again, without knowing what the cause is, it's very difficult to discuss preventative measures. Being able to identify what it is specific about people with sarcoidosis that can perhaps help us think about prevention is something we're very interested at the University of Maryland, to try to identify markers for the disease that might help with diagnosis. And sometimes if you understand what those markers are, you can understand why they appear, and that information can help one try to understand how to prevent it.
So what is the prognosis of someone being diagnosed with neurosarcoidosis?
Well, it varies. And as treatments get better, prognosis improves. We've seen that with other diseases. There are some manifestations that may not be progressive, and it can be very hard to predict for a person whether or not they may develop involvement that will respond very nicely or may be very difficult to treat. several treatment approaches have been developed in recent years.
Okay. I was going to ask you what are some of the treatments, but now that you're talking about it, it's
Sure,
great.
sure. So we saw with the disease MS, where about 30 years ago there were really no treatments, and now there are 13 drugs on the market, many options, and it's a totally different disease these days. We'd like to see the same thing happen with sarcoidosis and certainly NeuroSarcoidosis. So the way to treat these autoimmune diseases and sarcoidosis as well is to modify that response that occurs with the immune system so that it does not attack the immune system or does not attack it so much. And one can use immunosuppressant medications that suppress immune function. One would want to do that enough so that the overactivity of the immune system is modulated to slow down or stop the attack that's taking place. One can do that with medications which have been marketed for treating some cancers actually or other immune problems. And based on the mechanism by which they work well for sarcoidosis.
Okay.
At this time, we do not have an FDA-approved drug for treating sarcoidosis. Well, actually, there is one FDA-approved drug. I misspoke. The drug ACTH, which is what we are studying in the clinical trial.
Okay.
It was approved back in the 1950s before a clinical trial was done. So we really don't understand as well as we need to how best to treat patients with it, what types of conditions it'll work best for, and just how to use it in general to effectively treat people, and that's what we're looking at in the clinical trial that we're doing.
Okay, are there any major side effects of any of the drugs?
Many of these drugs do have side effects from, first of all, from the fact that they do suppress immune function to some extent. And when you do that, theoretically, a person is more susceptible to developing infections. So one has to be monitored very closely for that. That susceptibility can come from the fact that the immune system itself can be very suppressed, so one has to monitor lab studies, blood studies. With certain types of very profound immunosuppression, you can actually get other autoimmune diseases appearing, so one has to watch out for that as well.
So let's talk about, because I want to get this in, let's talk about what is ACTH? So I know you mentioned the clinical trial, so let's kind of get that in about
Sure.
what that is.
Well, ACTH, and it's marketed under the name Acth. It's actually a protein that's produced by the body. The body produces a form of it. And it's a hormone that stimulates the body to secrete its own steroid, as well as hormones that can regulate sodium metabolism, and to some extent kidney function. It turns out that that hormone itself, in addition to stimulating those other things to occur, can have direct effects on various cells themselves, including immune cells and brain cells, and actually cells in the skin, cells in the lung. And we think that by regulating steroid responses naturally and stimulating the body to produce steroids, which can be good for treating sarcoidosis, those other direct effects with it acting not by stimulating steroid, but interacting with the cells themselves, we think that could provide some additional benefit, so that theoretically one would not have to rely as much on the steroid effect and can get the direct effect as well from the treatment.
Okay, so I know that the show is going very rapidly, and I have so many other things to ask you, but I really want to talk about the clinical trials, because I know
Yes.
you are conducting that clinical trial. So for everyone that's watching, can we talk briefly
Sure.
about the clinical trials, because they will be able to check the credits and contact you. So just let us know about the research as far as clinical trials and how it's helping people.
Fantastic. So we're looking at this drug, ACTH Acthar, in NeuroSarcoidosis. Others around the country are looking in other forms, pulmonary sarcoidosis, but it's an open label study at this point, which means that whoever joins the trial will get treatment. And the treatment will go on for 12 months. And during that time, the participant will come in for neurological examinations, thorough neurological examinations, MRI scans. We'll actually do blood testing and spinal taps on the individuals as well, so, because we do want to try to identify markers that can help us diagnose the disease, and really, as importantly, to know when a person's responding to the treatment. And so, so that's what we're doing, and it is a small study, and very often it's important to start off small to get a sense for how effective the drug is and what information you need to plan a larger study, which is what we'd like to do a larger study and ultimately be able to know exactly what to expect with the treatment.
Okay. Unfortunately, this is time to wrap up the show, but I'm glad you were able to talk about clinical trials. So for those who are watching, and if you have neurosarcoidosis or you know someone who has neurosarcoidosis in the DMV area, however, if you are out of town, you can still contact Dr. Royal, and he can explain to you exactly, how you can participate. It is important for these opportunities because it helps to researchers to find a cure or something that can help us cope better with the illness. So at the end of the show, please make sure you get the information, contact Dr. Royal for anything regarding the upcoming clinical trials. I'd like to thank you, Dr. Royal, for being on the show. I really appreciate it, especially helping people who are not having a productive lifestyle with neurosarcoidosis or not having one with sarcoidosis in general. But also, I like to thank my viewers for watching. Continue to share the videos for people that need this. Stay positive. As I always say, don't let this disease, don't become a prisoner of sarcoidosis. Live your life. And God bless everyone, and thank you so much for watching, and see you next time. And don't forget, get the information for the clinical trials. Contact Dr. Royal, because this is very important to make sure that you can live a productive lifestyle for yourself, for your family. Thanks for watching.
Thank you.